Kayla, Shayla, Frankie, and Alex present the ever-evolving role of registered pharmacy technicians. Hassan, a registered pharmacy technician and compounding manager at the Oshawa Clinic Pharmacy, was our interviewee. He has been working at this establishment for over 2 years now. Question 1. Having the designation of both a registered pharmacy technician and compounding manager, can you define what a compounding pharmacy is and provide examples of the types of medications you generally compound? Compounding pharmacy is synthesizing products that are not commercially available in other pharmacies. Pharmacy technicians and assistants are responsible for producing, preparing, and compounding prescriptions as requested by a physician and make them with the patient's best interest in mind. Essentially, it is catering to the needs of the patient. Examples include lollipops, suppositories, and lozenges, along with lip balms, hormone replacement creams within a syringe, and compounded capsules.
Question 2. What type of equipment is essential for your most common compounding procedures? There are various equipments used in the compounding pharmacy. An example is the unguator mixer, which takes the cream jar and a mixer, and you put cream and powder in it in order to mix it well enough so that the powder is just seamlessly, evenly distributed over the jar. And then for making specialized capsules, we have a mill for the powder in order to even out any unevenness in the powder to put in the machine.
Question number 3. What method of inventory does your pharmacy use to maintain accurate stock records? Hassan told us that he keeps track of the inventory collectively with the help of his coworkers. He uses a visual system to take into account the amount of stock that they have on the shelves, and when he is not there, his coworkers, both techs and assistants, look at what they need and they will record what they think Hassan should order. He then evaluates how much and which medication to order, as he doesn't want to stock up too much on expensive medications that will not be used. Narcotics and controlled substances are monitored through a computer software as per legislation, whereas the regular powders aren't, because they're just too hard to accurately track through the computer software.
Question 4. What is the role of the registered pharmacy technician in performing med checks? Does it include duties such as setting up appointments and taking the best possible medication history? Are these responsibilities the same for a pharmacy assistant? So Hassan himself does not do the med checks. They are done in the clinic pharmacy and not the compounding lab. Other technicians will set the appointments and only give information the patients are entitled to. And after these appointments are set up, the pharmacist will complete the med checks with the patients.
Question 5. What security measurements are implemented in your pharmacy setting, both for the customer and employee theft? The Oshawa Clinic itself has cameras and alarm systems. Narcotics and controlled substances are locked in a safe in order to limit access for those without the code. And the clinic itself has third-party security companies that come in and protect the clinic.
Question number 6. Being a clinic pharmacy, does your pharmacy team offer any extra services to your patients, such as flu shot clinics or other disease state management clinics like asthma or diabetes? His answer was yes. They do flu shots and they do INR checks. They used to offer smoking cessation at the pharmacy, but because their building is full of doctors, they have their own means of starting smoking cessation therapies for their patients, so they will go to their physician in the building.
Question 7. What made you choose to work in a compounding pharmacy versus an alternative setting such as a hospital pharmacy? So when Hassan got registered, he had 2 options: to check strips, which are compliance packs for nursing homes, or compounding. He did not know what compounding entailed, so he took it on as a challenge, and at the end, it became a personal preference.
Question number 8. Would you ever consider becoming part owner of a pharmacy? Why or why not? Hassan had said that if he had the capital, he would consider being a part owner of a pharmacy, but currently he is not interested as he is busy outside of work with family matters.
Question 9. On a scale of 1 to 10, 10 being the highest, how stressful do you find your line of work? On that scale, he finds it a 4, with stress fluctuating from day to day. Coping with that stress varies from person to person. So Hassan gets stressed out with figuring out how to compound with certain medications. But he also stated that the fun factor in figuring out with the compound helps him with the stress.
Question 10. On a scale of 1 to 10, 10 being the highest, how rewarding do you find your line of work? For Hassan, this was an easy question to answer. It was an automatic 10 out of 10. He said that making a kid happy is very rewarding, as he's making a medication for them that they couldn't have had before. For example, a child who cannot swallow huge tablets, they would crush the tablets and put it in a liquid form, and then involve the child in the making of it by allowing them to pick a flavor, whether that be cherry or grape, to name but a few. This encourages patients to be involved in the synthesis of their medications and customizing to their needs.
In conclusion, the interview with Hassan has showed us the ever-evolving role of the registered pharmacy technician in their different scopes of practices with different pharmacy settings. This interview has also demonstrated the diverse opportunities available to us after we graduate, not just hospital or community pharmacies. A big thanks goes out to Hassan for taking the time to do the interview and give us a lot of invaluable information.